Thank you very much, and thank you for this opportunity to speak at this event, which is really interesting to me in a couple of ways. And so, I'm here in part to talk about, some lessons that can be learned from a long-running study like the panel study of income dynamics that would be relevant for the MauiWES or other registries or other surveys. So the panel study of income dynamics has been running since 1968 and has been doing so successfully. And so we've learned a lot along the way that will be of considerable interest to other studies and other groups. And one particular aspect of it is the supplemental studies that PSID has incorporated into its design. And so that's kind of an important and kind of unique way of thinking about how to enhance some of these long-running studies to make them effective over time. But I also want to mention, although it's not directly part of my talk, that this, my interest between PSID and natural disasters is an important element of why I'm here and why I find this interesting. And so my own background on this began actually with Hurricane Katrina. So a few weeks after the hurricane hit, I began working on Hurricane Katrina and have worked on it ever since. So once you end up on the disaster bandwagon, it's hard to get off. And then you find out that there are other disasters, and the skills that you learn as part of that are transferable, and you keep going. So I began working on a study that looked at repopulation in New Orleans. So the whole population was displaced, and we came up with a set of estimates about how quickly people will move back. That segued into doing a couple of surveys, the first one about a year after Katrina, and another one about 5 years after Katrina that sampled and interviewed residents of New Orleans wherever they were located, whether they'd come back to the city or were displaced elsewhere. And then the third, and my current scope of research, is using data linkage to study long-term outcomes among disaster-affected populations. So this is something that we haven't really heard about at all, and I'll just kind of mention it in passing here, though I'm happy to kind of talk about it more. But one of the things that's kind of emerged in the last few years is an opportunity within. It's actually the Census Research Data Centers, but they're now kind of broader, and it's called the Federal Statistical Research Data Centers. And what these centers allow people to do is link together census data with other federal data products. So these are not personally identified individual information, but they're linked together with codes. And so you can begin with something like a decennial census, and you can track people forward and backwards in time to their participation in other surveys like the American Community Survey or in other databases like the National Death Index or IRS records to look at where people live. So we've been doing a long-running study for the last too many years, 6 or 7 years, to look at the long-term outcomes of the entire New Orleans population and what their mortality rates are and where they have been living up through about 2019. So about a 14, 15-year period afterwards. Okay, so that's just a bit of an introduction of my personal sort of perspective on this, and let me segue then into talking about PSID. And one thing to say about PSID and studying disasters is that it's actually not particularly well suited for that. So this study began as a nationally representative study. That's what it really seeks to maintain, is national representation. Most of the disasters that we observe are kind of localized and have an important local component. And of course, PSID with that kind of design is not representative locally. What it really is valuable for, kind of with climate change and with kind of the experience of these disasters, is to follow people over their life courses and across generations. Because over people's life courses, they're going to be experiencing many more than a single disaster, and people move in response to these disasters and experience other disasters. So it's a really important, different way of thinking about life course and intergenerational exposures to disasters and their effects. Okay, so let me jump in now and tell you a little bit about the history of PSID, the study design and content, what the study looks like today, some response rates, infrastructure and sustainability issues, and then spend some time talking about the supplemental studies that are of particular potential interest. So PSID actually got its start in 1964 with the War on Poverty. So that's when, President Johnson declared, this unconditional war on poverty in the U.S., which, of course, the first question that would come to, minds for people in this room is like, well, what do you, how are you going to do that? Like, you declare war, you need to track it, you need to understand it, like what's happening? What are the dynamics of income and poverty? How do we understand this process over time? And what is the role that families and communities play in experiencing poverty and moves into and out of poverty? So this was kind of the key question that PSID was designed to answer. So at the time in the mid-60s, when people studied poverty, they had kind of snapshots. They had cross-sectional surveys of poverty rates, and they could tell you the poverty rate is 20% this year, and it could tell you it's 20% the next year. What they couldn't tell you is how many people moved into and out of poverty across those different years, and what were the factors that led people to escape from poverty or to descend back into poverty. So that was what PSID was designed to be able to answer, is how did those transitions into and out of poverty occur, and what were the factors that shaped them. And anytime we talk about poverty, the concept of poverty is a family-based measure, and so you can't think about poverty without thinking about family. And families are kind of key to thinking about poverty because poverty affects families of how it's experienced. And families are also affected by poverty. So family transitions are shaped by poverty exposures. And so understanding those interactions between the dynamics of income and the dynamics of families is incredibly important. So PSID began in 1968, initially as just a 5-year study to examine income dynamics among a national sample of about 5,000 families throughout the United States. So the original founding director of PSID was an economist at the University of Michigan named Jim Morgan, and he agreed to lead the new project, but sort of made a couple of conditions that turned out over time to be critical enhancements to PSID. So the goal of PSID was to take over initially something called a Survey of Economic Opportunity that was being done by the federal government. And Jim Morgan said, well, in addition to this study that focused on poor families, the study really needs to have a nationally representative sample of non-poor studies, both as a comparison group, but also in order to be able to look at transitions over time of non-poor families into poverty. And so he made that case convincingly. So about 3/5 of the PSID sample comprised of a nationally representative sample that all of them didn't begin in poverty, and allowed these comparisons. A second key feature was following individuals who split off to form independent households. So this was a key aspect in which everybody in a sampled household essentially got what we call the PSID gene, and if the household split up or if a kid grew up and moved away and formed their own household, because they had the gene, we would follow them in PSID in perpetuity. And so a neat aspect of that was that it allowed the sample to grow over time, and it allowed us to create intergenerational connections among our sample members. And so from this start in 1968 through to the present day, we now have multiple generations of the same families, 3, 4, and 5 generations of these families who have been followed in many cases for their entire lifetimes. Another advantage is that it sort of allows us to continue to maintain representation. It allowed the sample to grow over time. The only group that we miss are new immigrants. And so we've addressed that explicitly at a couple of times in our history, in 1997 and 2017, by screening and recruiting new samples of immigrants who have moved to the United States in the previous period from when we last recruited. So the PSID today is the world's longest-running household panel survey. It addresses many issues beyond poverty and family dynamics that were its initiation. It still maintains national representation with weights, And it includes an oversample from that initial SEO sample of low-income and African-American households, which is an important strength of the study. But it's now actually representative of the Hispanic population and of new immigrants because of these new immigrant samples that we added and because of the higher fertility in that recruitment process so that their children and their children's children end up joining the sample as well. So to date, we've collected 43 waves of data. We have information available on about 83,000 individuals and over 92,000 variables. So it's a huge database. Let me tell you a little bit about the interviews. So we interview PSID households right now every other year. We have a single primary adult respondent who's usually the reference person or the spouse partner. And they provide information about themselves, about their spouse partner, and about all other members of the family unit. And so these are people living at home or away. It could be unrelated individuals who kind of essentially have a family unit by living together long term. The data were collected annually through 1997 and then biannually after 1997. So the interview is about 90 minutes long these days with a little bit of additional length at the beginning and the end that has it adding up to about 100 minutes altogether. It was initially done in person and it switched to telephone, to CADI in 1993. Our big change most recently was in 2021 when we switched to a mixed mode design that includes pushing most of our sample to doing the interview by web. So that's been an important innovation that was actually a real challenge and caused some hiccups along the way, but has had a lot of benefits for a variety of reasons. We recontacted triggers for up to one wave after they're non-respondents, and after that they're declared panel respondents and are not followed anymore. So in recent waves, PSID has included about 11,000 households. There are about 13,500 reference persons and spouse partners, and about 25,000 family members in each interview. So the PSID has really broad content. A lot of it focuses on income, consumption, and wealth, which we measure consistently in each wave. But as you can see, there's a whole variety of other content related both to income and poverty. For example, housing participation, program participation, but also housing, time use, childcare, marriage and fertility histories to intersect with the family dynamics, and a fair amount of health data, but only self-reported health data. We don't have objective health measures, though our most recent innovation that I'll mention now just kind of in passing is to collect saliva samples for genetic markers. And so that's something we've been doing since 2014 and have began that with the children in the sample and have now been extending that over time to other sample members. We collect a lot of information about education, about other aspects of human capital, lots of details about jobs and about employers and about residential histories. So one of the important things is the entire database is geocoded back to 1968, so we essentially have almost continuous measures of where people lived since that time, where they went to school, the specific schools and colleges that they were enrolled in, and their employer's place of location. So a lot of detail. PSID has maintained exceptionally high response rates over the years. So the line in red is our re-interview rate, so that's the fraction of people who we re-interview from the previous wave, and it's in the last wave it was 94%. So we do really well wave to wave. We have little dips and jumps over time. That kind of dip in 2021 was associated with that switch to the web mode that, for which we had a fair number of kind of technological challenges. That was also COVID period that led to other challenges. So there's a slight drift downwards, but if you compare this to other national surveys, including federal surveys, the drift downwards is much less than in those other studies. And there are a whole variety of reasons why that's the case. And let me kind of explain some of those and tie those to some of the infrastructure and fieldwork protocols that we follow. So since the beginning of the study in 1968, fieldwork has been done by an in-house group at the University of Michigan called the Survey Research Operations Unit. So they're a group of survey research who specialize in data collection. They work on PSID. They also work on the health and retirement study, monitoring the future. They have a big portfolio of kind of complementary sets of projects that they work on. So in the case of PSID and HRS, they swap in alternative years when they're in the field, which allows us to maintain kind of a continuous group of professional interviewers who work for the study, who are dispersed all over the country. So we recruit throughout the country, even though all of our interviews are by telephone for PSID or by web. So we do relatively little in-person work, though we can interview people in person. Everything is computerized, so we use Blaze computer-assisted interview software and something called a Michigan Sample Management System to manage the sample. So this actually turns out to be a really challenging aspect of running the study. When we have about 11,000 households, we need to have this ability to switch the sample across interviewers and across modes. And so we've invested a lot in developing these sample management systems. And then we have a whole bunch of fieldwork protocols and procedures that are designed to maximize enrollment and retention. And I would say at the top of the list, and not even mentioned on this chart, are these family connections. So the fact that we're recruiting adult children of sample members, we have an obvious kind of way to enroll them, which is through their parents. And over time, as these family networks have grown through participation, we have siblings, we have cousins, we have uncles and aunts, we have grandparents, and kind of all of them help to enroll their other family members in the study, help us find them when they move. So these kinds of family connections are incredibly important for us to maintain our response rates, and a really key aspect of that. So we give generous financial incentives. We match interviewers with the same families over time. We have, increasingly with our new sample management system, we have a very structured and sequenced protocol of how we contact respondents using email, text messages, phone calls. We have multiple interview modes, including in person when needed. We have tailored refusal conversion techniques. And then one thing we do is a fair amount of interventions and incentives that we are actually able to experimentally test and refine. So before we implement any of these kind of new protocols, we test them on randomized subsamples in prior waves and examine whether they're cost effective and whether they're effective in the field. For example, we have a scheduler that we rolled out. We have early bird incentives, middle bird incentives, end game incentives, ways to end early to save costs. And we've tried these all experimentally and adopted the ones that have been successful. So PSID, similar in some ways, but different in others, is kind of designed just to be a public resource. So if we do research on PSID, it's kind of as a separate aspect of our research agendas, apart from kind of the methodological research. We don't use the data until it becomes publicly available. And so it's made available to the research community and to us at exactly the same time. And what that has meant is that it's been turned into an enormously valuable resource for the research community, with about 7,600 publications that have been completed to date, and about 1,300 dissertations. So we're up to about one publication every day using PSID across a wide variety of journals in many different disciplines and domains. So in my remaining time, let me switch to talking about PSID supplemental studies. And this isn't even the full list. There's a longer list, but I'll just focus on these three, on our studies of children, young adults, and then a new initiative we're launching in Puerto Rico, which finally connects my interest in disasters with a PSID data collection approach. So even though we had this design to recruit children into the PSID sample, they only became participants when they were adults. And so we'd study them as adults. They grew up in PSID families, so we knew a little bit about their family environments, but we knew relatively little about their experiences as children and their development over childhood. And so in 1997 was our first effort to try to address this. this gap in PSID's coverage with a study called a Child Development Supplement, which was to understand children's outcomes, social, psychological, and economic aspects, to be able to look at the effects of families, schools, and neighborhoods, and to track their development, both over childhood into young adulthood, and then all of these children ultimately become panel members, and so we can look at the effects of their childhood experiences and exposures on their life course trajectories. So CDS over the years has included cognitive, behavioral, social, and health assessments. So this was a component of the study where we would have home visits. So we'd complete an interview component, and then we would go into the homes and do assessments, weighing and measuring kids. We'd do achievement assessments on math and reading skills, height and weight. We'd collect saliva samples this way. We'd interview children, and we'd collect time diaries. So we had a long protocol of these in-home measurements. And our design over the years is to be able to collect 2 or 3 rounds of these over childhood, so every 5 years or so. And I should note that our measures of children's time use are nationally representative and the only source of information on children's time use in the US. The American Time Use Survey only starts at age 16. So in 1997, CDS began as a cohort study with children 0 to 12 years of age and up to 2 kids per family. It was repeated a couple of times with these interviews with the primary caregiver, usually the mother, and with older children who are 8 to 17 years old, though younger children participate in all the other components, including the time diaries. By 2014, the youngest children had reached adulthood, and so we relaunched the Child Development Supplement with a slightly different design, which was to collect information on all children in PSID families in each wave. And again, to repeat that design every 4 or 5 years to pick up new children who were born into families or who were identified for the first time, to include multiple, and in fact to include all children in families. So we have families as large as 8 children who are included in CDS, and would collect information on all of those children, not just 2 of them, and would collect information up to 3 times over the course of childhood. So we're now in the 3rd round of that data collection and this new design. We're in the field right now with the 2024 wave of CDS. We've just finished, we're just wrapping up the collection on adolescents in the study and are switching to collecting saliva samples for the cases. So this gives you a rough idea of the sample sizes. So it's about 4,000 to 5,000 kids who are collected information in each wave of this new design for CDS, and a similar size for 2024. We did an additional wave in 2021 to look at the effects of COVID that re-interviewed kids from the prior wave. So the transition into adulthood supplement for PSID was originally designed to follow those kids who we had up to 3 measures during their childhood to understand their early adult choices and decisions. You know, again, these kids don't become panel members until they are independent, but that period between reaching adulthood and independence is crucial for making a whole variety of decisions about living arrangements, about school versus work, about marriage and cohabitation and fertility and so forth. So the goals of TAS were really to focus on this important developmental stage where these decisions are made and understanding the factors behind these decisions. So it originally followed these young adults from CDS, and so our goal was to kind of bridge the content that we collected in CDS on aspects such as how they spent their time, how they're connected to their communities, with the types of information that would be collected in an ongoing basis for the rest of their lives in PSID, about work experiences, about employment, about occupation. And it also gave us the opportunity to collect retrospective information, which we've done on several different domains, including topics such as adverse childhood experiences, retrospective reports about child health, and related topics where we're interviewing them for the first time and they have this perspective on being able to look back over their childhoods and provide some information that, while collected prospectively, often is only at snapshots rather than sort of cumulative and integrative over a longer period. TAS, like many of the other studies, has links with school and college of enrollment and neighborhood context. So the TAS data, unlike CDS, is collected every other year. So it's on the same periodicity as core PSID, so it follows right behind the core interviews. So we're now interviewing young adults between the ages of 18 and 28. So we have up to 5 interviews over this 10-year period. All the respondents, the sample members, some of them are also members of core PSID, some are still living in their parental homes, and many of them, transition between those roles over time. And so we complement the information collected from core PSID so as not to duplicate it, and it reduces the interview length and is a bit more efficient that way. TAS also serves as our as a sort of testbed cohort for many of our new technologies. So we rolled out our web interviewing with the young adults in TAS in 2019, and it's gone exceptionally well. Our most recent wave, in which we just finished in mid-2024, we achieved a response rate of about 89%, and we're down to low single digits of respondents who are interested in doing the interview by telephone. So 97% do it by web, and it's really just a handful who are unable or unwilling to do it by telephone. And they seem to really enjoy and efficiently do it by web. The costs are much lower. The types of interactions are very different in enrolling and getting young adults to complete the interviews by web, and I'm happy to talk about that more. So let me switch gears entirely to Puerto Rico, and I know some of you are familiar with Puerto Rico, but let me give you a brief background for those who aren't. It's a U.S. territory and has important interactions with the rest of the United States. Puerto Ricans are U.S. citizens, and so they're free to move back and forth to the mainland U.S. Puerto Rico participates in many, but not all, U.S. social programs. It's covered by some data collection products that we have for the mainland United States, the decennial census, for example, and this is one. And there's a Puerto Rico community survey that matches the ACS for another. And Puerto Rico's recent history is really characterized by a series of crises. So this began in 2006, with a fiscal crisis that led to a bankruptcy of the government and high unemployment. In 2017, Hurricanes Irma and Maria struck the island. There was a major earthquake in 2020, and then there was a pandemic in 2019, 2020. And one of the interesting things about Puerto Rico's status and situation is that it has this release valve for any time there's a crisis like this, which moves to the mainland U.S. So that's what's happened in Puerto Rico, and the island has actually lost population. So it declined from about 3.7 million in 2000 to about 3.2 million in 2020. And what this has led to is one of the most rapidly aging populations on the planet. So Puerto Rico is in the top 5 oldest populations around, and you have this left behind population of elderly Puerto Ricans whose family members have moved to the mainland for job purposes, and they lack care, they lack, the workforce to provide care is missing, their family members are no longer there. And so the thing that Puerto Rico lacks to be able to understand the causes and consequences of all of this is panel data. So with a colleague of mine, Beth Fussell at Brown University, we received funding for an R01 grant from NICHD to launch a panel survey in Puerto Rico that's essentially parallel with PSID. And so we have been designing and working towards the launch of this survey, which will occur in the spring of next year. So we've done a bunch of work towards this, including developing a sampling frame for Puerto Rico, which previously didn't exist. Puerto Rico addresses are entirely different than those in the United States, and the types of mailing lists that are used to draw samples are not available for Puerto Rico. So we listed 26,000 dwellings with the help of students from the University of Puerto Rico, conducted on-the-ground verification. We developed a questionnaire, and we've completed the process of both testing it after adapting it to the Puerto Rico context. And so that involves not just translating everything into Spanish, which we had from core PSID, which is also administered in both English and Spanish, but in localizing the translation to the Puerto Rico context so that the Spanish terms were familiar to the respondents and to the interviewers over there. We also developed Puerto Rico-specific modules to ask questions about language skills and migration history, location of family members, and about moves back and forth to the mainland. So we're about to launch this, and we're hoping to continue it as a panel survey. So the advantages of it is that it can be used in conjunction with PSID to kind of grow the Hispanic sample and look at their experiences. We plan to track migrants who move to the mainland US and interview them. And in the future, it could be integrated with PSID if, who knows what will happen in terms of statehood for Puerto Rico. So here's where you can find out more information about PSID and CDS and TAS, and I'm happy to, also you can contact me or the PSID help desk for other information about the study.